Eileen Veilleux, the fam here. Welcome to the final installment on a mini mental health series on dyslexia. And in this issue, we are going to cover the diagnosis and treatment of dyslexia. But before we begin, let me remind you that there will be 3 keywords in this video throughout the video, so you're going to want to watch the whole video. When you're done watching the video, in the comments, please, with your regular comment, just put the 3 keywords in, because whoever puts the keywords in when I reach 2,000 subscribers will be entered into my merch giveaway. Second thing I'd like to bring up is Thursday I will be doing a new poll on the next mental health subject that you want to cover, and that will run from Thursday to Sunday. So saying that, let's get started. We're going to be going over the diagnosis and treatment of dyslexia, and we're going to start now. There is no single way to diagnose dyslexia. There's a number of factors used to diagnose this. One of it, your child's development, educational issues, in medical history. The doctor will likely ask you questions about these areas to find out if there are any conditions that run in the family, including whether any family members have a learning disability or not. Home life, they will ask for a description of your home life and to see if there's any problems at home, so this way they can determine if they're having a hard time reading just because of different stresses at home, or if it's from something else like dyslexia. Keyword, questionnaires. The doctor may ask your child or family members or teachers written questions. They may be asked to take tests to identify reading and language abilities. They do that to see if anybody else in the family may have any learning disabilities that may have not been diagnosed when they were younger. It helps them get a better grip on it. Psychological testing. The doctor may ask you and your child questions to better understand your child's mental health. This can determine whether social problems, anxiety, or depression may be limiting your child's abilities. Testing with reading and other academic skills. Your child may take a set of educational tests and have the process of quality of reading skills analyzed by a reading expert. And that's so they can help the child better, so they can learn at the best possible pace for them. Now, for the treatment, there is no known way to correct the underlying brain abnormality that causes dyslexia. It's a lifelong problem. However, though, early detection and evaluation to determine specific needs and appropriate treatment can improve success. So the sooner a person gets tested for this and evaluated, the better chances they'll have for success, not just in their school years, but in their adult life. Some of the educational techniques is what we're going to cover next. Dyslexia is treated using specific educational approaches and techniques. And the sooner the intervention begins, the better. Psychological testing will help your child's teachers develop a suitable teaching program so they can accelerate the best that they can. Teachers may use techniques using hearing, vision, and touch to improve reading skills. Helping a child use several senses to learn. For an example, listening to a taped lesson and tracing with the finger the shape of letters and use the word spoken can help in processing the information. Treatment focuses on helping your child to learn to recognize and use the smaller sounds that make up the words. Understand that letters and strings of letters represent these sounds and words, other known as phonics. Comprehend what he or she is reading. Read out loud to build reading accuracy, speed, and expression fluency. Build a vocabulary of recognized and understood words. If available, tutoring sessions with the reading specialist can be helpful for many children with dyslexia. If your child has a severe reading disability, tutoring may need to occur more frequently and progress may be slower. Individual education plan. This is the same thing that I went through in school, because I did have a learning disability. Mine wasn't reading though. Mine was due to my eyesight, which was hard for people to understand because I love to read and I always have. But in elementary, it was just called learning disabilities class. And it wasn't just people with dyslexia. There was autistic people. Anybody that had any type of a learning disability was in there. And then in junior high, from 7th to 9th grade, it was called individual guidance education. Some places call it individual education plan or IEP. Okay. I had what they call individual guidance education, which was I was in a regular class, but I could do work differently than everybody else. I could do like projects for whatever, like in English. Instead of writing and stuff, I could do a collage for my project, and I was able to work at a slower pace. So we're going to discuss a little bit of that. In the United States, schools have a legal obligations to take steps to help children diagnosed with dyslexia and with learning problems. Talk to your child's teacher about setting up a meeting to create a structured, written plan that outlines your child's needs and how the school will help him or her succeed. This is called an individualized education plan or an IEP. As far as the early treatment, children with dyslexia who get help in kindergarten or first grade often improve their reading skills enough to succeed in school and high school. Children who do not get help until later grades may have more difficulty learning the skills needed to read well. They're likely to lag behind academically and may never be able to catch up. A child with severe dyslexia may never have an easy time reading, but he or she can learn skills to improve reading and develop strategies to improve school performance and quality of life. Now, what you can do as a parent of a child that has dyslexia, there's a number of things you can do to help your child succeed. One of them is to address the problem early. If you suspect your child has dyslexia, talk to your child's doctor. Early intervention can improve success by a long shot. Read out loud to your child. It's best if you start when your child is 6 months old or even younger. Try listening to recorded books with your child. When your child is old enough, read the stories together after your child hears them. Work with your child's school. Talk to your child's teacher about how school will help him or her succeed. You are your child's best advocate, and that is so true. Encourage reading time.